It is Thursday, July 30th. July 30th. Man, where is the time going? Well, we do have some reports for you. Lloyd Phillips, of course, will be here to talk about the meeting that was held yesterday with the COVID-19 task force. And of course, as we get closer to September, there will be lots of questions coming up about education. And to start us off on that topic, we'll bring in the Executive Director of the Kahnawake Memorial Hospital Centre, Lisa Westaway. Lisa?
Thank you. So we've been receiving many questions about school openings. So on behalf of the task force, we would like to announce to the community that we have officially approved the reopening of schools in September. Of course, this is based on what we see today around us in the community, and it will continuously be reevaluated until the opening of schools. So there is that possibility that things may change between now and then, but looking at it today, and in order to give families the time to prepare, we wanted to announce that as of today, the opening of schools will be approved. So we've looked at many different aspects in order to make these decisions. Especially looking at the child as a whole, in the same way that we did looking at all of individuals as a whole for the reopening of business. There are many aspects that are important to the development of children, notably, of course, the educational instruction that happens within the schools, the development and support for social and emotional skills and development, the environment, providing a safe environment for learning, looking at nutritional needs, and also the importance of physical activity for children. All of these aspects are positive reasons for schools being reopened and could contribute to significant losses the longer that schools remain closed. So some of these positive aspects for school reopenings have been noted in several different studies that we've been consulting. This one that I'm referring to comes from the Center for Disease Control and Prevention. However, these same variables are looked at in many other theoretical documents. So there could be some negative impacts as well to opening schools, and we know that that's with respect to health and safety. For that reason, the Education Center has the responsibility to develop plans for reopening of schools, and they've been working hard for several months on these plans. Of course, the biggest objective is to mitigate risk to their staff, to the students, and ultimately to all of our families in the community. The task force will look at that plan and with Dr. Gautier's assistance ensure that it is medically sound before the reopening of schools, and all of this information will be presented to the community next Thursday. So Robin Delarone from the Education Center will be here, and she'll be presenting information. So we have to really consider the fact that presently there is no transmission of the virus within the community. We have seen that we could successfully and safely reopen much of our businesses without having a negative impact to the health of the community. And for that reason, considering all of the positive impacts of reopening schools, we have to look towards the future and this new normal and find ways to be able to move forward in a way that's safe for all of us. And so this is why at this particular time we have approved the reopening of schools. So again, Robin will be here next Thursday, and she'll be providing further details regarding this reopening. And as the coming weeks go by, we'll be sure to answer questions that the community may have regarding this important aspect. Thank you.
Thank you very much, Lisa. And don't forget that this coming Sunday there will be another chance for you to drop off some items for your loved ones at the Kahnawake Memorial Hospital Centre. And this time you will be allowed to bring food. So for information on that, just go to the website and you will get all the information you need. And that's a lot of good news. A busy time for Lloyd Phillips. The understatement of the year, probably. Yesterday, he was chairing the meeting of the COVID-19 task force, and he has a report on that.
Thank you, Lisa. Thank you, Joe, for that update, and certainly much more information to come on that in the coming weeks. And obviously, like Lisa mentioned, the health and safety of the children, staff in the community is always going to be first and foremost, which has been the mantra of the task force since the beginning, and that has been guiding us, since day one, and will continue to guide us as we move forward. With that said, we did have a discussion yesterday at the task force on the remaining aspects that need to be reopened. In this case, we talked about the bars and social clubs and the tentative date that was set for August 10th for those to reopen. After a lengthy discussion and looking at many aspects and the holistic approach that we had taken, at this point in time, we are not comfortable with maintaining the August 10th date for reopening of bars and social clubs. So that date will be pushed. That will be retabled for further discussion with the task force to establish a new date that we will target for the reopening. Bars of that nature has been proven not only in this area but around the world to be one of the major areas of transmission of the virus because of close proximity, because of a high contact area, because of a lot of touching of glasses and bottles and so on, as well as obviously if you throw alcohol in the mix and people get more relaxed, and the social distancing aspects could go out the window very easily. So at this point in time, we're not comfortable giving the green light for that aspect. So again, like I said, that will be revisited in the coming weeks. Also regarding gyms, we know in the community are still closed. There was some brief discussion on that. There was some more discussion today on that as well. That's in the process of being evaluated to seeing how and if some of the gyms could open either with limited capacity or open in a safe manner. So those things, again, are being evaluated, and those decisions have been made as of yet. But certainly, I just want people to know that those things are also part of the consideration that the task force has been taken. As I mentioned on Tuesday, a lot of work is being done looking forward towards the possible second wave of the virus. A topic that we don't want to really discuss very much, but a topic that we have to discuss, and breaking it down into steps. We did have a very lengthy discussion on what those steps could look like. We have more information coming from all the stakeholders who were involved in the task force, as well as general community members, on feedback on how I guess kind of the first wave of the virus has been dealt with in the community. What were the pros and cons, and what worked, and what could be done better. So all this information is being compiled and has been compiled, and what we're doing is breaking it down into some phases. I did speak more generally about this on Tuesday, but what we're looking at is basically a phase that we're kind of in at this point in time, and I did touch on this briefly on K103 this morning, is what we're on, even though things are not completely reopened and we're still under a state of emergency, we're also in this state of monitoring. Now, we're monitoring what's happening around our community. We're monitoring the infection rate within the province, within the Montreal area, within Canada, and obviously keeping a close eye on what's happening in the States, which I'm sure people know is not going very well at the moment. They're reaching record highs in states such as California, Texas, and Florida, and it seems that pandemic is working its way north once again. So hopefully they'll get a hold of what's happening in the States, and that will lessen the impact on everybody for that matter. So we are also in that monitoring phase to see what needs to take place at various points in time. We're also in the implementation phase, as Lisa touched on. We're looking at moving forward with schools. A lot of plans have to be happening on that part. But we're going to be determining what scientific evidence and health evidence do we need to move to the next phase. If we see a dramatic increase in the rate of infection in our area, increased level of death, more and more outbreaks, and then that would probably constitute us looking at a different phase, which at this point we're talking about more of a heightened vigilance. to ensure that the messaging in the community is changing, almost like a warning on what's happening, asking people to take measures even stronger than they're taking, and making sure people are aware what the next steps could be if things don't turn around. And then we break it down into steps. Like a step one, assuming the state of emergency has expired, step one may be the reinstitution of a state of emergency and reactivating the full task force, again, assuming that has expired. And then we have to look at such things as, limiting workspace contacts, meaning basically less people in one room working together. We may have to revisit the gatherings. Right now, it's 10 people in a household, 50 people in a public space. Things of that nature may have to be reassessed to see if they could maybe have to be reduced or other measures put into place to ensure safeties. If various businesses are open, such as restaurants and bars, if they are open by that point in time, then we have to again look at possible limitations on those areas. Look at the visitation, such as at the Elders Lodge and Kahnawake Memorial Hospital Center. If we are in a state where we are not really sure what the next steps are going to be in terms of the virus, in terms of the pandemic, obviously we would have to revisit those areas. Obviously, that's the responsibility of the organizations such as KSCS and the hospital, but certainly they would have to revisit whether or not they want to maintain the open visitation, and these things will have to be assessed on an ongoing basis. And also, plans for schools. As we mentioned, there's a lot of work happening with the schools in terms of making a safe plan, but overarching that will have to be a plan put into place to say what are the elements required, from a scientific and health perspective. At what point in time do we decide collectively to say it's time to close the schools? And that would have to be something that we want to have predetermined, so if we reach that threshold, we know ahead of time that certain things have to happen. So, that's something, again, we hope we don't have to go down that path, but again, if we do, we want to have some of these pre-plans in place so that we address it in a quick as possible manner. And if things continue down a path, again, we have what we call the KERM, the Kahnawake Economic Relief Measures. We have the emergency food services that are currently in place. If things are anticipated to start closing down, we may have to reactivate those areas of the KERM and the food services. At least get them prepared, get them ready to take on extra clientele if that's something that would need to be happen. So we want to be able to have a plan in place, so if we need those services again, they're rolled out much quicker and much smoother, and again, learning from what went right and what went wrong in the first phase. Let's fix those and make sure that whatever services the community requires, whatever support the community requires, happens as quickly as possible. We also have to look at, obviously, looking at limitations on hours of businesses, and as well as look at making alerts like stay local alerts, essential services only, things of that nature would have to be obviously considered if things keep going down a path, and that would be basically broken down into like a step 2, and finally a step 3, which obviously would be somewhat of our worst case scenario, where we'd be looking at going back to a full essential service only within the communities, issuing stay-at-home orders, unfortunately having closed down non-essential businesses, things of that nature. But it has to be all part of a plan. Like I said again, I'll say it again, that that's a path we don't want to go down. But if we need to go down that way, we want to make sure it's done in a systematic way, based on science, based on evidence, and based on everything that we learned to date. Keeping in mind the health and safety and well-being of our community is first and foremost. So much more work to be happening on that. I'll be sharing more and more information as time goes on. A lot more details will fit into this plan, and we will share with the community, so it's not a shock to anybody what the plan looks like if we have to institute a plan. So we'll keep that as an ongoing update for Facebook Live, so we'll be able to keep you informed, let you know that we're still continuing to monitor, we're still continuing to plan, we're still continuing to look after the best interests of our community to ensure that we maintain our diligence, we maintain the fact, and do whatever we possibly can to keep the pandemic at bay, and do everything we possibly can to ensure that the number of active cases in our community remain at 0. So with that, I thank you very much, and I'll see you again soon. Kahnawake.
Thank you so much, Lloyd. And of course, with the task force being diligent, it's great to know that the community, you guys, have been extremely vigilant, and that's I guess the biggest part of the job is to make sure we continue to stay the course. Wash your hands as often as you can, and stay, give that social distancing thing, take it very, very seriously. We're doing okay. With that, of course, we'll be back next Tuesday unless some emergency happens, and let's hope that everything is going to be cool. Enjoy your weekend, folks. Thanks for watching wherever you're watching from, and we shall see you next time. On behalf of all of us here in Kahnawake, Kahnawake.